Bismillahirrahmanirrahim. Today we will discuss coronary heart disease, also called coronary heart disease. The aim of this series of lectures is to give third year MBBS students of Khyber Medical University some guidance on their learning objectives related material. And this is an introductory lecture to this issue of coronary heart disease or coronary heart disease. So, ultimate learning objectives of this series of lectures is to discuss coronary artery disease risk factors and strategies to reduce them, and discuss strategies for primary and secondary prevention of coronary heart disease in outpatient settings. Obviously, before going into other things, we should know what is a coronary artery disease. And key pathophysiology is demand supply mismatch. Mismatch occurs in the form of not enough blood and oxygen supply to meet the needs of the heart. That is ischemia. So it could be obstructive with narrowing of epicardial coronary arteries above 50%, non-obstructive less than 50%, and microvascular coronary artery disease involving small arterial blockade like small branches of the arteries, or you can say capillaries. Statistics are alarming. It is the leading cause. Previously, the cancer was. Now coronary artery disease has taken over as a leading cause of death worldwide. And even in a developed country like United Kingdom, 1 in 3 men and 1 in 4 women die from it. And 330,000 people have MI, 1.3 million having angina. But due to good treatment modalities, mortality has been reduced to 42% in the past 10 years. Eastern Europe and Asia are seeing rising trends in the coronary artery disease. What sits at the basis of coronary artery disease is atheroma and its complications. And obviously, its major complication is thrombosis. When atheroma is fixed and it is causing ischemia, it is stable angina as a manifestation. And if it is dynamic atheromatous plaque that is undergoing some rupture and thrombosis, not major obstruction, it is called unstable angina. And if it degenerates further, leading to necrosis due to total occlusion, due to plaque rupture and thrombosis, it is called myocardial infarction. And obviously, when the supply to the myocardium is reduced, there would be myocardial dysfunction. If it is totally cut off, then the myocardium will also not function. So that would be manifested as heart failure. Even a slight ischemia or infarction can lead to arrhythmia. And a patient can die suddenly as well, bypassing all these clinical spectrums, landing with ventricular arrhythmia, systole, or massive myocardial infarction and sudden cardiac death. These all conditions are related to coronary artery disease and its complications. This is the simple take home message. So that is why we would delve deep into primary and secondary prevention of coronary artery disease and what are the risk factors that can lead to this massive problem. And in the next lecture, we will delve deep into the risk factors. And later on in the course of time, we will address primary and secondary prevention strategies. And this slide presentation here is just an awakener for our dear students so that they can know that why we need to study the risk factors of coronary artery disease and why we need to prevent it. Thank you for listening. Stay tuned for further discussions.